Dr. Stefan Walzer here from the CEO of Mars, Market Access and Pricing Strategy, and of course our good friend Matthias Flume from the KV, from the Physicians Association here. So welcome you both here to our webinar. Interesting topic today, but just before we head into that, we want to thank all our participants. We got like over 100 registrants for tonight, and of course we send out also a little Christmas present. So this is Glühwein, a nice bottle of Glühwein. The first 21st registrants received by mail. You got a package with this small bottle of German Glühwein. So the important thing is, don't drink it cold. You have to heat it up, and then so it's like a tea, you know, and then you just slightly slip it as a tea and enjoy the wine there. It's wine with Christmas spices. So, and it warms you also from inside, gives you a little bit of Christmas feeling here in Germany in the cold time. And of course, we are Mars. We are the German-speaking market access experts for Austria, Germany, and Switzerland. So what we do is we do price and reimbursement strategy, develop that for you in Germany, in Switzerland, and for Austria. And we do calculations and all the health economics. We manage all your reimbursement submissions for the German Federal Joint Committee, GBA, also with the DIGAS, the new digital applications, for the Swiss BAG and the Austrian Hauptverband. And of course, when it comes after you submitted all the paper, there are the price negotiations. So we support you there, including our virtual reality bootcamp, where with newest scientific approaches, we train you here for the price negotiations. Okay, as always here, questions are welcome. So feel free to ask questions after the presentation. We will have plenty of time for your questions. So you can either use the Zoom chat function or the question and answer function here in Zoom to raise your question and comments for all that. And as always, that is always one question raised up by the audience. Other slides are provided. This is so cool. Or do you have the video later available? Yes, both we provide you for that on our webpage. So the slides that will be sent out to the participants. So it's really worth to be there. And of course, go on our website, www.market-access-pricing-strategy.de. And then you go on the webinars, and then you have here also our webinars, like the last one about the 2020 US presidential election and how does this will probably affect all the market access in Germany or Europe or the US here. And also there you can find all our missed webinars or the webinars you missed. Okay, now welcome everyone here to the Xmas, to our Christmas special edition of Mars webinar, the end of COVID-19 due to vaccines. And once again, here, Stefan Walzer, welcome you tonight.
Thank you, Lutz. Thank you, and also big welcome, obviously, to Matthias Flume. Also, basically directly jumping out of the day-to-day work and also the preparing, basically, the vaccination programs, then also in Germany. And looking forward to hear as well directly from you the latest news, how we could basically implement the vaccination programs then in Germany in the next couple of weeks and months. Okay, before we let's say go into those kind of details, I also want to thank, obviously, also mention that slide, Sebastian Grimberger, one of our team members, who has also prepared a lot of those simulations and who was also providing a lot of those slides. So big thank you as well in this direction. And now I think we can directly jump into the topic. Let's next slide, please. So I think just to set a bit the scene, I think that's basically what you all know also from the different countries you might be coming from. I think we have quite rising number of COVID-19 cases in the last couple of days, weeks, and months. I think Germany was maybe, let's call it a bit behind also in comparison to especially some of the other European countries. And I think we have just hit, I think last Friday, I think it was, we have hit basically the 30,000 cases a day. And we have those kind of, let's say, drops and up and downs a bit over the week. I think if you just slide it out, I think, but you see clear trend upwards. I think we all know that curves and those curves. And I think our Chancellor Merkel was as well then tightening together with obviously all of the different regional politicians and the parliament further rules before Christmas. But on this, at the same time, I think that's also the topic why we're really here. I mean, we have also seen really, really good news, I think, with the different kind of vaccination results. I think BioNTech and Pfizer was one, but also Moderna and also AstraZeneca, I think, had quite good news. And we're obviously as well waiting for further potential kind of vaccinations, whether it's Johnson & Johnson or other companies. I think it's a clear pathway. I think it also clearly shows what science can basically provide also within such a kind of short time frame. Still, I think the question remains a bit, obviously, and by when we might potentially have the lives back. And I think the focus for today is obviously not so much the kind of big assumption when we would really have all basically, or let's say a good a proportion of the population being vaccinated, and we take Germany as an example, but rather to basically simulate a bit the different kind of scenarios which might happen. We still don't know exactly when the first vaccination might be available. We still don't know how many of the population might really be open for vaccination. And we also don't know, for example, how long the kind of, let's say, safeguard around the vaccination might be applied once you have received the first vaccination. So those are the kind of scenarios we might want to build in those simulations. But obviously, we all want and hope, obviously, that the vaccination are as effective as we all hope that, and also as long as possible, and that we have at least the minimum number of population being vaccinated that we could get into kind of herd immunity, where I think the lives could really come back at the end of the day. Next slide, please, Lutz. So before we come to those simulations and the scenarios what we put together, I think let's first of all jump a bit more into the direction of the vaccination programs and how those could be really then being implemented or organized. And again, we take the example of Germany. Just next slide, please. In a nutshell, and I think Matthias, you might as well take that a bit in a couple of minutes as well on your shoulders. I think we have clear target groups, and I think that those are quite, I think, consistent, at least across Europe, right? It might be especially the elderly, especially residents from nursing homes, and obviously as well different personnel who are working in high risk of exposures in medical facilities and other directions. I think overall, next slide, Lutz. There's at least, and that's, I think, maybe as well something what we're as well looking forward to understand, there should at least be 406 vaccination centers ready in Germany. I think the deadline was ready a couple of days ago in general, right? That the setup is being done. I mean, you see a quite good split across the country. And I think maybe as well here important, what you can then as well, let's say, probably here, in a couple of seconds, then Matthias, you are basically around where it says Nordrhein-Westfalen, where you see quite a good number of those green hits. And I think you have as well quite a responsibility around that area to also build up those kind of vaccination centers. Next slide, please. So what we obviously, before going into the simulations, I think, you know, the theory is one thing, right, Matthias? But I mean, the practice, the practical aspects are obviously important things. And I mean, you have that quite nice kind of advertisement as well on your website of the KV grandmother and grandparents getting a hug. Let's make it possible, right? That's basically what it says there. So looking forward, Matthias, to also get to know directly out of the kind of organization where we stand, how it's being implemented, and also obviously where you see potential kind of maybe even drawbacks out of the organization. So I think for the next couple of minutes, looking forward, the floor is yours.
Yes, Stefan, thanks a lot. Welcome everybody. Good evening. First, I may introduce myself quickly. As you heard, Matthias Flume, pharmacist, MBA, based in Dortmund. It's a beautiful city with a great soccer club in the middle of Germany. And I work for the Regional Physicians Association since many years. Just to give you, for those people from outside Germany, we cover more than 11% of Germany with 11,000 physicians and more than 8 million people living in this area. And yeah, at the moment, people everywhere are becoming very entrepreneurial, even in public structures, and have to organize the vaccination. And yeah, maybe I would start from the theory. Stefan showed you the strategy. Maybe you heard the idea, oh, we do everything in centers. This is in the first moment smart, thinking about this initial idea. The vaccine is very complex to handle, at least the first mRNA vaccine from BioNTech. But on the other hand, if you start thinking about the number of people and also the prioritized groups, then it's a little bit contradictory to bring elderly people above 80 with high risks into long queues into centers. So this is the first thing where I personally started to think it sounds smart, but how sustainable it is. And I think we will see an approach where we initially will start with several centers, like Stefan showed. If you compare this to other countries, which also have some centers, but in the UK, at this moment, to my knowledge, more than 1,000 GP practices are vaccinating and no center started yet. Other countries have also so-called centers, but a much higher number. If you look for Greece, they announced about 12,000, about 10,000 in Spain. If you compare this to the number Stefan showed you for Germany and compare to the more than 80 million people living in Germany, then it's a tricky thing. So we have set up centers everywhere in Germany. Now the first message came, we have very few vaccines in the first week only, which are supposed to arrive somewhere next week over the Christmas days. And now the strategy for the first weeks is that no patients are vaccinated in the centers, but it's more focused on nursing homes, so to do the vaccination there. This is the reason why I had a quite long day today and the last days, because of course you have to establish the contact, find physicians to vaccinate there. Because now, as we learned that the vaccine is complex to store permanently with a minus 70 degrees, I'm referring to the BioNTech vaccine, but on the other hand has about 5 days storage capability in a regular freezer, then it's not that complex anymore. So we would try to give some leeway that it can stay for a few days in the fridge in the nursing home to be more flexible to vaccinate patients living there and this stuff. So currently we're preparing for somewhere after Christmas, but still in this year, to immediately start vaccinating more than 20,000 people in our region in nursing homes. Ideally this year. This is of course very, it's a big step because all the ramp up for the centers was done and now it's all in nursing homes. But then after Christmas, if more supply arrives, we will get also some centers working. There I see more challenges. Today it was announced that from the 6th we have the Moderna vaccine, which seems to be even easier to handle. We have a prioritization that we have millions of patients eligible for an appointment in a center. But how do you manage a center for older patients? Because you can only offer as many slots as you have vaccine doses at the moment. So if you calculate with the actual available number, you can offer only very few slots in January, February, have 1 million people on the phone in the call center. And very soon the capacities will increase, but you do not know really why. And sorry, not why, but when. So what we will see is that we will get the centers working in January and still continue vaccination in hospitals and nursing homes. Then we will see a huge outcry of patients, people complaining we don't get an appointment because of the simple mismatch between available doses, therefore available slots you can allocate, and many people who are eligible. I think this is what we will see in January. Then in January, we will hopefully have the Moderna vaccine, hopefully AstraZeneca, Johnson Johnson also following soon after. And I personally believe that we will see some traffic in the centers, but that we then relatively soon, end of January, somewhere February, start vaccinating also in GP practices to get a better uptake and have then maybe the centers as a kind of overflow for people to get their second shot or whatever. That's my personal assumption. As I told you, in the moment, it's quite complex because we have a decentral logistics. This is maybe also something you can take as a takeaway, where we have still room for improvement in Germany, because thinking about you want to get a vaccine which is difficult to complex to transport and handle, quick to the patients, then the question is what is sensible to do? Do a sophisticated logistic to service the existing vaccination sites, like practices, whatever, or you build a new vaccination structure parallel to the existing structures where you need personnel and so on, and have a logistic which each federal country has to organize on its own. Let's wait and see. It will work somehow, but I think we have some challenges ahead. In terms of recruitment, maybe the last thing, the advertising, we got about 11,000 physicians, nurses volunteering to support in the center. So this is really great. You see there's a high dedication and enthusiasm to work there and help. But when it comes then to the question, oh, can you work Monday morning? Oh no, there I'm in my practice, so it will work, but it's challenging. Yeah. So I hope I could give you a slight overview what we do every day, that it's moving a lot. The targets we are aiming at move a lot. I hope I could also explain a little bit and point to the differences when you talk about centers in Germany and in other countries in terms of how many patients they would need to service, and yeah, everything else in the discussion. And for those of you who enjoy the Glühwein, I don't know if Stefan and Lutz send it out. I don't like it, so I can recommend very good beer from Dortmund the next time. Maybe Stefan thinks about this as an option. And yeah, thanks for listening and look forward to the discussion.
Perfect. Thank you, Matthias. I think it's actually a very good kind of suggestion also with the German Dortmund beer. I can agree. I think it's not only a nice city, but it has even a great football team. So, okay. I think very good insights, I think, Matthias. I think it shows you already, I think, where also maybe the kind of difficulties might be seen in the near future, but also maybe in the midterm. I think there are a lot of, let's say, or a good number of uncertainties. And that's, I think, what we also now try to implement a bit into the simulations and the analysis what we have done. Let's next slide. So for those of you who have basically already followed us in the last couple of months and yeah, probably nearly a year now, I think you have seen already, I think, that slide for a couple of times. So we are using a well-established and a well-known simulation model, which is the so-called COVID sim. That's actually also being used, for example, by the regional government in Baden-Württemberg, which is in the southwest of Germany, where, for example, I am located. And we have used that already for a couple of different analyses. It is an SEIR model, so a susceptible, exposed, infected, and recovery moved model. It is well established. It has been used also in different jurisdictions, not only in Germany, but, for example, has also been used, for example, in terms of the discussions for the containment measures in New Zealand, for example, but also in other countries. So next slide, please. So before we come to the actual kind of analysis and the simulation for the vaccination, what we have done, firstly, we have taken the model, the COVID sim, and have basically fed it with the different input data which has been used for Germany. We've used, for example, different input data also from the Robert Koch Institute, but also from other epidemiological sources. And what you can see here is a clear kind of fit, let's say, obviously not one-to-one. That's the standard kind of result. I think there's always a bit of uncertainty, but I think it has very close numbers. So for example, the confirmed infectious cases for today by the Robert Koch Institute were roughly 1,400,000. And that was also around the number of infections what we got when we have used the COVID sim model. That's basically the day 324. That was basically coming back to the first case what we had in Germany back in January this year. It just shows that the model can be used to also analyze the German environment. So now really going into the kind of looking forward. I think also maybe before we come to that, thank you, Lutz, there was also a kind of short flashback. We have had another webinar, I think back in June, where we have also modeled the kind of further containment measures over summer and also the potential drawback, I think then back in autumn. I think what we have basically modeled also with the different kind of lockdown light, what was also announced by politics then in late autumn, was that if all, or let's say a big majority of the population in Germany would have really applied and complied with that kind of lockdown light measures, we could have really ended up with roughly 6,000 cases a day by Christmas. I mean, let's call it, we're significantly above that number a week before Christmas. So it also clearly shows that I think that whole kind of lockdown light didn't really work out. I think that was also our scenario analysis already months ago. And it was also then announced and also agreed by all of the politicians roughly a week ago when the new measures were put into place. Next slide, please. So too hopeful. Infections, it just shows the kind of numbers going up. So we can just probably jump over that and now really go into the potential influence of the vaccines. First of all, if we speak about vaccines, we just generally say there is a vaccine available, right? We have not modeled directly the impact, for example, by the different effectiveness. We know the Moderna and also the BioNTech Pfizer vaccines are somewhere around the 95%. There are a couple of question marks around the AstraZeneca one, whether 70% or roughly 90%, also depend a bit on the dosage. We don't take that currently into account. We just simply say, and that's also, I think, a quite good analogy, for example, to the influenza A and B vaccination programs. I think vaccinations help, and vaccinations obviously support the whole kind of environment in order to get the number of infections further down. So what we have put together is a set of different scenarios, just to analyze what if we might not get directly to, let's say, the optimal point. We have that as an add-on scenario with let's say, an acceptable number of vaccinations after a couple of months. So scenario one, quite clear. We would just generally say, just imagine the EMA would not get approval to the vaccination. Vaccine is not available soon. Maybe there might be a kind of drawback in the data. I mean, I personally have seen the publication. It looks good, high number of patients, whatever, but it's obviously not the original data. So I personally believe scenario one is not really likely, but we also want to show a bit the kind of differences between scenario one, which is basically the current situation, and then the scenarios, what if a vaccination is then available. So scenario one, vaccine not available soon. Stop, let's just one back, please. It is prolonged and then lifted contact restrictions, because obviously we would all know that we cannot live, I guess, in the way we're currently in. And I think some of you as well in other countries might really live even longer in such a kind of lockdown scenario for further months. So there might be at least some kind of, restriction liftings in the couple of next months, if that would not be the case with vaccination. Scenario 2 is then where we say, yes, vaccination is available as being announced and also explained by Matthias a couple of minutes ago, but just at a later time point. That could be because of logistics, maybe a kind of issue also what the Matthias just described, maybe the kind of question, 406 centers, is that really enough? Can we really get all of those patients there, especially the elderly? I mean, he explained very well, I think, the different kind of, let's call it issues. And now we would just assume that, for example, just 8.6 million people would get the vaccination until end of May. 8.6 million sounds a lot. Just imagine we have around 83 million people in Germany. So it's roughly 10% of the population would have been then vaccinated by the end of May. So this is a scenario with a bit of a delay of the vaccination being available. And the scenario 3 is a bit similar, but where we have just said we, let's say, relax a bit the assumption from the timing perspective, and that just say that the vaccination is now really available December 23rd, maybe the 25th or the 27th. But generally, I think the assumption is that the EMA is deciding in December this year that the vaccination by BioNTech Pfizer is available, and that roughly those 10% of the German population would get the vaccination until the end of February already. This is then also how Matthias just described, if all of those kind of scenarios and logistics basically really work out. So this is a kind of, I think, is a quite fair assumption at the end of the day. But ultimately what we're then also looking for, which is clearly much more interesting, is the add-on scenario, where also our health minister has just announced, I think 2 days ago as well, in different news, in the television, also in newspapers, that he's expecting that 60% of the population will be vaccinated by the end of September. So those are the 4 scenarios we'll now go through. Just also keep in mind, I think the numbers are based on the COVID-10 simulation model. So it's more the kind of direction, obviously, where we would really need and should have probably a look for. Okay, starting with the first scenario, which I think to me would look a bit scary in a way. I mean, if we just, let's say, assume that the vaccine is not available soon and we would need to somewhere relax a bit the kind of containment measures, etc., we would basically look for around 2.6 million infected people by the end of June, which is the kind of peak in a way, which is more or less doubling. Just imagine and just remember the numbers I have just presented some minutes ago, where we had today around 1.4 million infections, and we would have then just 6 months later another 1.3 million infections, which would, I think, also mean that we might really as well have another issue in the hospitals. And we see already as well now the kind of news from the hospitals. You see also here the hospitalizations would be around 93,000, ICU admissions as well, quite high. So this might as well obviously have a major impact on the German healthcare system as well. Move forward, because we all believe that I think also the EMA will follow the data, will follow the submission. Let's go first with scenario 2 then, which is already saying the vaccine is available at a later time point, maybe assuming a bit of logistic issues, maybe a couple of issues Matthias just pointed out, which would still mean that we might have by the end of June, again, in 6 months' time, around 800,000 more infections, which is also shown that even if we only get, let's say, 10% of the population being vaccinated by the end of May, it would only help a bit, right? I mean, you see that already, the difference between scenario 1, which is currently, and scenario 2, it will have an impact, but not that dramatic as if you would really have even a better kind of outcome. And you see that also when you go to the number of hospitalization. That's maybe where you see also kind of bigger impact at the end of the day, at least from a feelings perspective, I think, right? Around 92,000 cases versus 76,000 cases based on the simulation, but you see as well proportionally, it would still significantly go down. Whether it's enough to really, let's say, help as well the healthcare system to deal with it is maybe then another question. Scenario 3 is then the case where we believe is probably quite accurate and quite feasible. Decision this year by the EMA, again, just keep in mind. And then obviously that would be already a quite big jump, I think, and a big success, I also think, is that around 10% of the population would already be vaccinated by the end of February. It might be, as Matthias as well just said, probably a lot the elderly, physicians, nurses, nursing homes, etc. And that shows already a big kind of difference. Keep in mind, scenario 1 was 1.4 million, 1.3 million more infections until end of June. Here we would have 400,000 new infections, which is obviously a totally other dimension than before, right? So we would also have, in terms of hospitalizations, it would basically already go down by roughly 30%, and also the ICU admissions would further go down dramatically. It's something what we would expect, right? But I think the core question always was, would we as well raise at the end of the day, when would we have our lives back, right? 400,000 new infections. Keep in mind, we had now roughly 1.4 million in, what it was that, 10, 11 months, 400,000 there. I think it's at least as well go slowing a bit further down, right? Which is also an important impact. And also keeping in mind that end of May and in June, also summer and spring, obviously, is just in the starting, right? Where we also had, I think, a quite relaxing time period, for example, in Germany this year. Okay, next slide, please. If we take all of those three scenarios now together, just press the button again, Lutz. You see as well the different kind of impacts. One further, when you go down from scenario 1 to scenario 2, and then also scenario 3, one more button, please, Lutz. You see basically that the number of infections are significantly going down. You know, the 17% between scenario 1 and scenario 2 doesn't sound so big at the end of the day, but if you take, for example, the impact from scenario 1 to scenario 3, where we would just say 10% is being vaccinated by the end of February, which that would already mean that around 30% of less infections, which is obviously a huge kind of impact already, but just this kind of small proportion, right? Just as a kind of assumption, just imagine we might get another vaccine as well available, maybe even a third one, maybe as well Matthias pointed out, we will potentially move even out from the vaccination centers into the practices. I think that's obviously even a further impact, and I think that's maybe something. One more slide, Lutz. What we might see in scenario 4. So, if you, let's say, interpret that slide, I think important is also here what we had early on, right? Before in scenarios 1 to 3, we wanted to analyze, let's say, for the next 6 months, because that was a bit of the idea, when could we really maybe deal again with our lives in a more kind of normal way. I think the health minister was announcing the aim is at least to get 60% being vaccinated, 6% of the German population being vaccinated by the end of September. That's, I think, normally the kind of numbers what you also find in literature as required in order to have a herd immunity. And that would also mean that you just have around 77,000 additional infection cases until the end of September. So I think if you take here the number around June, it's obviously as well a bit lower. I mean, just have a look on hospitalization, ICU admissions. This is, I think, a number where we can all probably feel quite well, and just thinking that life could probably come back in a kind of normal way, right? Hospitalizations around 2,500 additional cases, right? I mean, not that we basically do not have any other additional, any other hospitalization. This is just purely for the COVID-19 hospitalizations, right? And around 350 ICU admissions. I'm pretty much sure that those would be the numbers I think also the healthcare system could, for example, deal with. Not to forget, obviously, the kind of health impact, that's quite clear. But I think if you see those numbers, it shows as well quite clearly if this would be the target, if this is something what we can achieve, it can basically as well be the kind of, let's say, game changer as well. This year already, next year, I'm already in 2021. So next year, that the life is probably coming back. Keep in mind, for the ones who are as well reading a bit the figure in more detail, if you look beyond September, it's also a bit of the question what is happening there, right? We don't know whether the COVID-19 would maybe as well come back a bit further and a bit stronger, for example, next autumn. We see that with the influenza A and B. infections every year, right? That maybe in autumn is also coming back there. A bit of an uncertainty what we have as well, and not yet taken here into account, is also if there might be another shot of a vaccination being needed for all of the vaccinated already. I think that's as well a bit of a question mark. So I would just rather say let's interpret the data until June, or in this case, I think until September. I think that's something what we can probably more or less model in a quite safe and certain environment. I think everything beyond that is probably something what we as well, first of all, need to learn as well further, also from the data and also from the different vaccines being then available in the next couple of weeks and months. Next slide, please. Okay, potentially influencing factors or impact factors, I think beyond what I have just said as well. And I think this is really summarizing, I think, what we have also heard already from Matthias some minutes ago. Availability of the vaccine is a question mark. Is it really being available in December, or is maybe further postponed? We've heard about some delivery kind of, let's say, question marks into Germany, which might also be the logistics around it. Readiness of the population. I mean, when I hear some of the questions on those vaccinations, you know, it might also take a bit of a further, let's say, campaign to also, let's say, educate as well the population. I'm pretty much sure that this will as well follow shortly after the vaccination is available. It's also then the question, how many of the really a number of people we would really get into a vaccination program per day. Matthias was just pointing out that this is also a big question mark, how some of that could really be implemented, and also the kind of immunity, and finally also the impact and duration of the contact restrictions, which is then also the big kind of question mark, right? Okay. Next slide. So as a conclusion, I think at the end of the day, I think vaccination will help to get obviously our lives back. I think that's nothing really new, I think what I'm telling you. But I think from my perspective, from our perspective, I think what we have also discussed about the different scenarios is quite clearly, I think we would need to have a quite fast and speedy kind of, let's say, uptake of the population to be vaccinated. I think that's quite clearly and important. I mean, you just keep in mind the scenarios 2 and 3. 3 is already, let's say, a bit better, but I think in 2, when we would only have 10% of the population being vaccinated by somewhere in late spring, I think this would not bring our normal lives back. I think if we go a bit beyond and maybe we're a bit faster and maybe getting 10% already being vaccinated in February, that's already kind of speedy uptake, right? I think then it's still the question what happens afterwards, right? I mean, how and when do we get the rest of the, let's say, at least additional 50%, I think, of the population being vaccinated? I think if we get the aim of Mr. Spahn by the end of September, I think this would probably bring our lives already back, not just with the starting of September, but in the course until September. You have just remember the lines of that curve, right? It doesn't really go up dramatically. It has obviously always a bit of a let's say, flow there. So we will always probably have still a number of those cases, but I think at the end of the day, it's probably around the number we can manage. And just keep in mind, because I think what we have as well read, I think at least I read that as well this morning in the paper, and we have had a lot of discussions also with our friends from Egypt, for example, and some other parts of the world. I think if you only obviously vaccinate a few countries properly, I think we will never stop that pandemic anyway. I think we might always get here and there potentially further hotspots, right? So I think it's also important that we need to keep an eye on the overall kind of global pandemic to get also other countries pretty much well under control. And I'm not only speaking obviously about the European Union, but also across that, I think Asia, Africa, South America, or clearly North America, but I'm pretty much sure that they have similar plans. So I think this might as well have a further impact quite clearly, but I think at the end of the day, it clearly shows vaccinations will help, but it will also only help if we all, let's say, help, let's say, the system in order, or let's say in the way that we also get our vaccines pretty much soon after it is being available, given the plans which are then also being available in the different countries. I think, Lutz, that was the kind of part, I think, very nice, Sebastian, thank you again. Vaccination or vaccinations around the Christmas tree. Have a happy holiday, quite clearly. I mean, I think that's at least I think when I have spoken to my kids, they were really happy that the vaccination might be seen in the near future. And they're also happy that potentially we might even get that the vaccination at least being approved in Europe, right, before Christmas. So it's really, I think, around the Christmas tree. So I really like that as well. Thank you, Sebastian, as well, to put that again together.
Yeah, I'm sure that's a new runner for the radio stations, vaccination around the Christmas tree. Yeah, thank you, Stefan, for this wonderful presentation. Thank you also, Matthias Flume, for your insights here. Actual insights, just really brand new about the vaccination status, how that's going to be organized here in Germany. And then I want to invite you, Stefan, and you, Matthias, here for the question and answer section. And we already have some here set. So one question actually is asking us, how meaningful is market surveillance for adverse effects under COVID-19 vaccination as it unfolds over 1, 2, or 3 years? On the one side, we have these allergic reactions that are like easy to report because, you know, they come immediately. But what about adverse effects that the greater population experience when patients leave the vaccination clinics? Are there any plans for that? How to handle that? No, if you go there, as the systems are in place once the reporting gets done, or what will be, how that's going to be managed?
We have in the centers there is and in this first center phase there's a surveillance by the Robert Koch Institute established with also some challenges in terms of data transfer. Another story, very German, but this is more a surveillance to get an idea what groups of patients have been vaccinated and how many vaccines have been distributed. For the side effects, there's a regulatory monitoring and reporting. Also later, if it's if the vaccination is done in the outpatient setting, and I mean at latest all vaccinations administered in the outpatient sector, they can be tracked then in the statutory health insurance claims databases. So there are also some projects in progress already to do this long-term maintenance out of the routine data of the statutory health insurance, plus the individual reporting on a case-by-case basis. But I think for the acute reporting, we learn that in some cases there can be a risk for an anaphylaxia for patients who have a predisposition. The other cases, what we hear is that it works quite well, that you have some immunogenic reactions like fever and so on. I think it's not a surprise if you have a 95% efficacy against a virus where there's never been an exposure before against in the community. So yeah, these are the systems which are in place, and yeah, I think it will be carefully observed.
I heard today in the news that there will be also an app by an institution where they ask you, you can download that in the App Store, and then you can contribute as a study participant there.
To report side effects?
Yeah, to report side effects and also to report the efficacy of the vaccine, so you can later, you know, tell them if you really got like the COVID or not. So I think that is also useful. We'll see how. I mean, we already had experience with our Corona warning app, so how this going to be working, especially with the special German habitude of data protection, right?
Yeah.
Okay. So yeah, a lot of people say thank you to our presentation, but there are more questions actually coming. So one question is probably for you, Stefan, or for you, Matthias, is how will you prioritize who of the eligible persons will get a vaccine? Will it be a first come, first serve fight over this holy resource, or how is this going to be?
There are different mechanisms in place. Legally, it's the vaccination is not provided by the statutory health insurance, but by the federal state in Germany, and there are prioritization criteria. And of course, if you have a group prioritized, like people in nursing homes, living in nursing homes, you cannot vaccinate them all on day one. This is then not a decision of the physician. There is for each city, a board established which takes the decision which nursing home is going first, and it has simply to be decided. It's such an individualized decision. You must look where you have more vulnerable patients maybe than in others. What's the infection risk in the certain area of the city? Currently today, we had some cases where nursing homes had to be taken down from the list because COVID infections just came on. So it's this is the way how it's done there for the centers. You will have to book an appointment, and you need to belong to one of the eligible groups. But there will be queues, of course, at the beginning. It's I mean, the swimming pool is full of water, and you start to drain a little hole at the beginning, and then it becomes bigger. This is how it works. So, but on the other hand, I mean, it's I always, on the other hand, tell people we are not talking about the last 3 seats in an atomic shelter, and the rockets are already flying in. It is, it's of course very important to prioritize to get it to the most vulnerable patients or those at the highest risk first, but it's possible to protect yourself in the meantime. So I think it must, and this is what I see at least currently in our region, that there is an approach, what is efficient, where do I have also units where I can efficiently deliver the vaccine, have a good organization stuff in place, that it's really then done immediately, that you get all the people there. So it's a part of everything, and some patience is needed, of course.
Good, thank you. So there's also the questions about a slide we had on scenario 4. I mean, we had that increase at the end of 21. So do we have to expect a 3rd or 4th wave or seasonal wave of COVID, Stefan?
Yeah, I mean, that's probably kind of a question I was expecting. I mean, I think first of all, I think it's important to also see the scale of the figure, right? I think the scale is obviously on a much lower level than the scale of the numbers in the other scenarios. So I think, yes, there might, at least from this assumptions perspective, there might be maybe a kind of further wave upwards, but this is clearly, I think, also due to the assumption of maybe a further kind of shot needed by vaccination, and also by potentially kind of seasonal impact, right? But I mean, as already said, I mean, when I was on that slide, I think from my perspective, it's better probably to, let's say, take the first 6 or 9 months into account, because I think this is probably the kind of time frame where I personally would feel, let's say, quite comfortable to utilize and also interpret the data. I think what happens afterwards, I think, is probably as well a bit difficult to foresee. So I mean, I would personally not say that there will be a 3rd or 4th wave, but I think there might be further kind of questions around the, you know, if patients might, or let's say, no, sorry, the vaccinated population would further be prevented to spread the virus as well, right? Which is, I think, still, and I think that's maybe as well a question back to Matthias, but I think to my knowledge, I think this is also still the question, right? If this will help. I think from my perspective, what we have had in the model was, I mean, even if those vaccine or vaccinated population would potentially still be, let's say, potentially spreading the virus, I think obviously the more vaccinated people we have, the more are basically protected against it, and hence we have that kind of herd immunity, right? Then we still have one or the other person maybe being infected. That's what we see here in that scenario, but we don't get the kind of big hotspots what we currently have, right? And the big kind of spread across the different population. I think in that way, I think also the healthcare system could deal with it.
Thank you. And a question to our man at the front, will people actually know what type of vaccine, like the BioNTech, the AstraZeneca, the Moderna vaccine they will receive? And would that be also important for the second time of the vaccination?
First of all, how we manage this, especially the centers and the other structures, if we have more than one vaccine available, is not finally cleared. It will also be a federal decision because, as I said, this vaccination program is delivered by the state. So we will see. My personal assumption will be that we will see if more vaccines are flexible, gravitation to centers for vaccines which are more complex to handle, like the BioNTech, and more focus on GP practices and vaccination in the field for products like the one from AstraZeneca, or what we know about the one from, I think, Johnson & Johnson is also designed more suitable for the outpatient setting. So this is, I think that there will be a question how the a logistical decision than a patient individual decision. Our strategy, as far as we can influence it, will be that we will, at least at the beginning, not try to mix up different vaccine types in one vaccination site, either in a center or in an outpatient setting. This is what I can currently say or predict how it will work. What's the question? I mean, there are interesting discussions, of course, if it may be even sensible to combine two vaccines. So that's a very smart question. But formally, the SMPC, as far as we can access them from other countries, they say it should be with the same vaccine. And before we do not have further evidence, there will be an approach to deliver the same vaccine to the patient, to one patient for both shots, and only in case of supply shortages or whatever, do a vaccination or a booster shot with a second vaccine, which may be then better than no booster. This is my assumption currently, but be aware, at least for Germany, we do not even have the SMPC for the first one available.
Good point.
Yeah, that's a good point. We heard all the news, also that little bit distraction news, you know, US is starting, UK is starting, and we are still waiting. And now the EMA, they decided to get some news on Monday, right?
Yeah.
So probably we'll have like the first vaccine here available on Monday.
Below the Christmas tree, because then the EU Commission needs to take a decision, and then it has to be shipped across the full street where everybody is going to winter vacation at that time.
Yeah, thank God we are all in lockdown, so maybe that was the reason for the lockdown, so, right?
Switzerland is open, by the way. Huh?
Yeah,
we are very close to the Swiss border. But
okay. So there's one comment. So we don't know yet if the vaccine will prevent from further dissemination of the virus. It's also about the second, if like there's a mutation of the virus and stuff. So what is your opinion? Will really this vaccine will affect, and when or if we get our lives really back, how you managed in the title?
I combine my pharmacological and pragmatic background. I think it's very promising that we see a really good efficacy in the published data already, that the vaccines are much more effective than we initially anticipate or hoped. Especially, for example, the data where I had the closest look at was this FDA paper about the clinical data of the BioNTech, and I personally found it really impressive to see that the vaccination, the infections in the active arm most of them occurred in the first 2 weeks, and then the curve became almost flat while the control arm went up. So of course it's a question, is a reinfection or an infection still possible under vaccination? We will learn this, but I would say this is our smallest problem at the moment. I think we have a very good chance to get us in a kind of way of herd immunity somewhere by the summer. Then we will see and learn, but with everything I know about infectology is if we have managed to initially vaccinate 60-70% with an effective vaccine, even if there are some issues in terms of loss of efficacy after a time or whatever, we are then having a setup where we can manage this either with additional vaccination. We have now pharmaceutical knowledge to develop vaccines against COVID-19. So it will be interesting to learn this. There will be challenges down the road, but I think this is then sailing in much calmer water than we are doing at the moment.
Okay, wonderful. I think it was a great statement for the end. Thank you very much once, Stefan Walzer, Matthias Flume here for joining us tonight at the Mars webinar. And now, I mean, we can just wish you happy holidays, wherever you are, whatever you believe. Merry Christmas, Happy Hanukkah. We wish you all the best in 21. Stay healthy, healthiness and peace, both. We wish you that 21 will be a more peaceful year than it was in 2020. And with that, we're just moving to the year 21, and we want to say that this is the next webinar. That digital health in Germany started off a rocket or just a big bluff, and there we also have a special guest, then Ulf Maywald from the State Health Insurance. AOK Saxenia will join us to discuss that topic with us. So last Thursday in January, 9 o'clock here in Germany or 12 p.m. Pacific time. Feel free to join. Thank you very much all. Have a good night and good luck.
Thank you all. Stay healthy. Merry Christmas and have a good start into the new year. Thank you. Bye.
Thanks a lot. Stay safe and hope we all see us live again in the summer vaccination.
Absolutely.
Yeah.
Thank you. Thank you for joining us, Matthias. Thank you. Bye-bye.
Thank you. Bye-bye.